On this Saturday night, the fear of a new strain in the UK. It moves faster and infects more people.
It could be up to 70% more transmissible than previous strains.
Now parts of Britain are in full lockdown and Christmas is cancelled. The holiday rush before more Ontarians are put into lockdown.
People who get infected over the holidays may not have a hospital bed in January.
Why experts say just stay home. Plus the learning curve from the front lines, what doctors have discovered since the pandemic began, and Wi-Fi on the moon. The mission underway so astronauts can phone home.
Global National with Robin Gill.
Good evening and thank you for joining us. Tonight, a new, faster spreading strain of COVID-19 is bringing holiday plans to a halt in parts of Britain. The new variant was first reported earlier this week. It's common for viruses to mutate. Here's what we know about this strain. It's not considered deadlier. However, it is 70% more transmissible. In London, for example, the strain has been linked to 62% of new COVID-19 cases. So as of midnight, London, East England and the Southeast move into a new Tier 4 alert level, forcing families to cancel Christmas. As Crystal Goomansingh reports, all of the United Kingdom will soon see lockdowns put in place.
We don't want to, as I say, to ban Christmas, to cancel it, and I think that would be frankly inhuman. It is with a very heavy heart, I must tell you, we cannot continue with Christmas as planned.
It took just 3 days for this political 180. A new emergency lockdown in the UK is set to throw millions of lives into turmoil.
As Prime Minister, it's my duty to take difficult decisions, to do what is right to protect the people of this country.
Britain's Labour leader supports protection measures but is appalled by the government's handling of the pandemic.
The Prime Minister has a habit of pushing away challenge, of refusing to see a problem until it later confronts him. And I think lots of families will be saying, how has this come about at the 11th hour in this way?
Starting Sunday, London, East and Southeast England will move into the toughest set of coronavirus restrictions, now known as Tier 4. All non-essential business must close and people have to stay home. That means millions of cancelled Christmas get-togethers. Gatherings will be permitted in the rest of England and Wales, as well as Scotland, but only on Christmas Day. And right after December 25th, Wales, Scotland, and Northern Ireland will go into lockdown. This week alone, more than 173,000 people tested positive for COVID-19 in the UK. And there is a new strain of the virus circulating. It's up to 70% more transmissible than the original. The highest occurrence has been in southern England.
In order to reduce the risk of more of this strain being imported into Scotland, we intend to maintain a strict travel ban between Scotland and the rest of the UK.
Earlier Saturday, anti-lockdown demonstrators clashed with police on the streets of London. The new restrictions will only add to mounting frustrations. Crystal Goomansingh, Global News, London.
Italy has ordered a nationwide lockdown over Christmas and New Year's to stop an expected surge in cases over the holiday season. The entire country is now under red zone restrictions. Non-essential businesses like restaurants and bars are closed, and people can only travel for work and emergencies. Italy has the highest death toll in Europe. More than 68,000 people have died since the beginning of the pandemic. Restrictions are being tightened in hotspots in Canada. Today, this country surpassed 500,000 cases of COVID-19 since the pandemic began. Alberta, Ontario, and Quebec have the most active cases in the country, according to yesterday's tally. Ontario Premier Doug Ford is holding 2 days of emergency meetings as infections mount in that province. But as Morganne Campbell reports, despite the appeals to stay home, many are heading out to fulfill their holiday needs.
With the lockdown looming and Christmas just days away, many flock to Lime Ridge Mall in Hamilton, about an hour west of Toronto.
It's busy, a lot of line.
Some stores are asking, do you know what you want to buy right away?
instead of like letting shoppers browse the stores.
There will be no more browsing come Monday as Hamilton locks down, joining Toronto, Peel, Windsor, Essex, and York Region. Nearly all non-essential businesses will be forced to close, including much of the retail sector, restaurants, and personal care services.
This closure of business is going to be helpful, but it is not the only measure that people have to adhere to. It has a lot to do with the social interactions that we're seeing in our community.
Hamilton has seen a 40% increase in daily COVID case counts as Toronto and Peel Region continue to report triple-digit numbers on a daily basis.
The Ford government has indicated that more lockdown measures and restrictions will likely be announced come Monday. Medical professionals have said that this would be the most ideal time to implement lockdown measures across all of southern Ontario.
Due to the fact that many take holidays, school is on a break, and many sectors ramp down production.
This is actually a very reasonable point in the year. People spend time at home, spend time with their kids. And so, all you have to do is, be a bit more aggressive during this time. It's not going to be horribly inconvenient.
My fear is that people who get infected over the holidays may not have a hospital bed in January when they need it.
Earlier this week, the Ontario Hospital Association called for immediate action to curb the spread of infection, as many hospitals are nearing their breaking points. Meantime, Ford is hosting an emergency meeting with hospital leaders throughout the weekend to discuss next steps. Morganne Campbell, Global News, Hamilton.
There is hope that a vaccine will make the difference in the fight against COVID-19, but after the virus has run rampant for nearly a year, there's a lot of work to do. As David Aiken reports, vaccination programs are now underway across the country as many regions struggle to cope with rising case counts.
No feeling, it's just great.
You didn't feel anything?
A little bit, but not much.
Okay, well that's good.
I'm used to getting needles.
In all her 84 years, Colette Gauvin has never had a needle like this one. She's the first in New Brunswick to get the first dose of the Pfizer COVID-19 vaccine. As a resident of a long-term care home, Gauvin and hundreds of thousands like her across the country are in the top priority group for the vaccine. And right after Gauvin, New Brunswick authorities administered first doses to an emergency room doctor, a paramedic, a nurse to seniors, and an intensive care nurse, all members of the key high-priority groups for vaccines in that province and others.
I feel more at ease now going to work because there's always a chance of an unknown. You don't know who's coming through the doors. And I'm just really happy that I can protect myself.
But the race to vaccinate enough Canadians to make a dent in case counts or mortality numbers will be a marathon run at a slow pace.
You're probably looking at pretty steady or even increasing mortality until you get most of the way through, more than half the population for sure. And I would think closer to 3/4.
After a week in which vaccination programs got underway, less than 10,000 Canadians have now been given the first of 2 doses of the Pfizer-BioNTech vaccine. Rising case counts are putting stress on hospitals in many parts of the country. Canada's Public Health Agency said Saturday there are about 3,200 Canadians in hospital because of COVID-19, including 650 in intensive care units. ICU beds are in such short supply in Edmonton, for example, that at a children's hospital there, patients in pediatric intensive care units have been moved to make way for critically ill adult patients. And meanwhile, the country waits for the approval of the Moderna vaccine, and Health Canada hopes to give it the green light next week. David Aiken, Global News, Ottawa.
In the U.S., millions of doses of the Moderna vaccine are already on their way to hospitals, where doctors and nurses are in full crisis mode. The country's death toll from the virus is close to 315,000. Now, Congress is meeting in a rare Saturday session, debating an aid package to help the millions of Americans struggling. Jennifer Johnson has the latest from Washington.
With Christmas just days away and millions visiting relatives, wait lines for COVID-19 tests in several states are up to 8 hours long. For 3 days in a row, the U.S. has broken records for new infections, while deaths rise to staggering levels.
It's heartbreaking, quite honestly. Young people, old people, people that I'm just now meeting and watching their families be devastated.
But more weapons to fight this pandemic are coming after the U.S. Food and Drug Administration approved a second vaccine, Moderna's, late Friday. It is 94% effective, and unlike the Pfizer-BioNTech vaccine, does not require extreme cold refrigeration.
We've determined that the vaccine's known and potential benefits clearly outweigh its known and potential risks.
6 million doses are already rolling out, 20 million by the end of December. An accelerated schedule as a handful of state leaders complained they received far fewer Pfizer-BioNTech doses than expected.
So to the governors, to the governors' staffs, please accept my personal apology if this was disruptive in your decision-making.
The federal government is promising more doses soon as hospitals, including now Johns Hopkins in Baltimore, run out of ICU beds.
We will crush this outbreak that has really terrorized us for the last 11 months.
As doctors battle to save lives, Congress is in a battle to save livelihoods. Republicans and Democrats have been locked in negotiations for weeks over a $900 billion coronavirus aid package, extending unemployment benefits and protection from evictions.
The American people have already waited for more assistance longer than they could afford.
A vote is expected Sunday. U.S. President Donald Trump has promised to sign the bill immediately, an early Christmas present for millions of hurting Americans. Jennifer Johnson, Global News, Washington.
Still ahead, we talk to Canada's Foreign Affairs Minister about China's coercive diplomacy. The global pandemic is top of the agenda for Canada's Foreign Affairs Minister. François-Philippe Champagne had a frank conversation with our Mercedes Stephenson about the challenges facing this country. Our Ottawa Bureau Chief joins us now to tell us about that talk and trying to navigate all this uncertainty. Mercedes?
Robin, Minister Champagne said that 2020 showed us both the fragility and the resilience of Canadians, with our lives upended in so many ways by the COVID-19 pandemic. On the foreign affairs front, that meant repatriating tens of thousands of Canadians back home. He told me it was a humbling experience, very much aware that he and his team were the lifeline that so many Canadians abroad were reaching out for, and that meant taking some pretty extraordinary measures.
I got a call from one of the airlines. They say, Minister, can you help us open the airspace? And nothing prepares you for that. You know, I'm a lawyer. I'm a public servant, but in a way, I've never done that in my life. And then I probably become somewhat of a travel agent for everyone, trying to open airspace, making sure people could get space. And our diplomats and our people and our civil service really stood up to the task.
Of course, there are two Canadians who still aren't home yet. Michael Kovrig and Michael Spavor, both detained arbitrarily in Chinese prison. The Trudeau government has recently taken a harder line on China, vowing not to bow to what has been called coercive diplomacy. I asked Minister Champagne why there was a shift towards that harder tone. Here's how he explained it.
China of 2020 is not the China of 2018 or 16. It's not just a metaphor. It is the realization of colleagues around the world. I do speak with foreign ministers on a daily basis, and everyone is facing the same issue, is that things have been shifting. We've seen a more coercive diplomacy. We have seen probably one of the worst form with respect to the arbitrary detention of Michael Kovrig and Spavor. And the way to respond to that is to stand united, to speak with one voice.
Well, the government still hasn't gone as far as sanctions, which some have suggested. Minister Champagne told me he's hopeful that international pressure on China to release the two Michaels will see them back on Canadian soil as soon as possible. Robin?
Mercedes Stephenson in Ottawa. And you can watch the full interview with Canada's Foreign Affairs Minister on the West Block with Mercedes Stephenson tomorrow, right here on Global. The detention of the two Canadians is considered tit for tat after the arrest of Meng Wanzhou in Vancouver. The CFO of Huawei has now launched a new argument to avoid extradition to the United States. Meng's defense team claims Canada can't be complicit in an attempt by American authorities to punish a foreign national for actions that have no real connection to the United States. It's a complicated case with international implications. Meng is accused of lying to an executive of HSBC in Hong Kong about the relationship between Huawei and its subsidiary Skycom, which was doing business with Iran. The U.S. argues the money being exchanged involved the American banking system and therefore was a violation of U.S. sanctions against Iran. Still Still ahead, the changes to COVID-19 treatments that are helping patients and those on the front lines.
You're watching Global National.
It's been nearly a year since the WHO first reported a mysterious pneumonia-like illness that was making people sick in China. Ever since, frontline healthcare workers have been on a steep learning curve, battling an unknown and invisible enemy. As Jeff Semple reports from inside one of Toronto's hospitals, doctors are quickly developing novel ways to fight back.
And we're going to go this way, okay?
Alexandra Abril was pregnant, just days away from her due date when she tested positive for COVID-19.
Now I'm pregnant, I have COVID, and I'm at the end of my term, and I'm about to give birth. What's going to happen?
During the first wave of the pandemic, Abril's diagnosis would have also shaken hospital staff. Infected mothers in some hospitals were kept away from their newborns for up to 2 weeks. But babies have proved remarkably resilient.
Overall outcomes have looked very good.
Abril's daughter was born on her final day of quarantine, and they were allowed to go home together. The baby tested negative.
I think as long as mom uses the proper precautions, then, keeping mom and baby together are the most important thing.
Over the past 10 months, staff at this Toronto hospital have had a crash course in COVID-19.
We know how to treat it better.
Dr. Jamie Spiegelman works in the intensive care unit, which is nearing capacity. Half his patients have COVID-19. This 69-year-old isn't getting enough oxygen, so the team performs a delicate dance, carefully flipping him onto his stomach, increasing his chances of survival. Patients also now receive steroids, such as dexamethasone. But despite all they've learned,
but we don't completely understand it, and I don't think we'll understand it until it's over.
Doctors point to the unexpected case of Delroy Noble. That's him back in May, on a ventilator in a coma, just 29 years old. Noble was overweight, but otherwise healthy. His mother was also sick, but with minor symptoms.
I spoke with the doctors and they said, "Mom, you have a real critical son." That sinked me, but I still never give up.
Doctors didn't expect Noble would survive, but after 2 months in a coma, he suddenly opened his eyes.
If you can hear me, can you blink twice?
They call me and tell me that your son is woken. I said, "My son, wake up." That's when I jumped. I was sitting there and I jumped here. I cried. Okay, we've been almost finished.
Now, nearly 8 months since he first became sick, he still relies on a walker, physically struggling, but emotionally upbeat. He's back home, playing with his nieces, and showing no interest in self-pity.
I made it out in the end, so that's all that matters.
2020 was full of terrible stories, but some still managed to find their way to a happy ending. Jeff Semple, Global News, Toronto.
Zero Gravity Network. Up next, the very long distance plan for space. When humans return to the moon, NASA has plans to bring a Canadian on board. And that's not the only first in the works. That crew may be able to send the first text messages from space. Global's Paul Johnson explains how scientists in BC are working out the long-distance logistics.
It's one small step for man, one giant leap for mankind.
All of us know the crackly transmissions we got from the Apollo moon landings of the 60s and 70s. The next time we hear from people on the moon, it's likely to be in 4G and with full bars. NASA and its partners around the world are on track to return people to the moon in just a couple of years. The Artemis program will see a new rocket and capsule fly to the moon for a series of missions that will put more people on the lunar surface, doing more things for a longer period of time. And no surprise, they're going to need to talk more.
The crew member could take their phone and call home. They could text their kids from the lunar surface from that phone.
And part of how they'll do that will be enabled by work done here in Vancouver, where researchers at SFU's Polylab for Advanced Collaborative Networking have been working with the Canadian Space Agency and Nokia, developing standards for a cellular network on the moon. The SFU portion is led by Stephen Braham, who's been perfecting communication to remote places like the Arctic for decades.
Stephen Braham is without a doubt a Canadian national treasure. I think that all the NASA communication people think that. We just love having Stephen involved with us.
So you can see how this might make for some awkward conversations with cell providers here on Earth. People might wonder if they can get it on the moon. Why do I get such lousy coverage at my cabin? And how will they justify roaming charges now? Though they may be getting the fanciest cell phone plan ever, they'll need it. Artemis will be the most ambitious space program to date. Their movements and research on the moon will lay the groundwork for trips to Mars and beyond. These are calls we won't want dropped. Paul Johnson, Global News, Vancouver.
Great story, Paul. That is Global National for this Saturday. I'm Robin Gill. Tonight, Your Canada is the skating rink at the Meadows Community Centre in Edmonton. Thank you for watching. We'll see you back here tomorrow.